I'm Dr. John Stenberg at Zenith Chiropractic in Colorado Springs, Colorado, and I want to address the topic of pediatric headaches. Now, there's two main categories of headaches that we'll include within this description, even though there are over 100 different varieties of headaches. And that is the tension type headache, which is the muscular tension and the squeezing, vice-like pain around the temples. Involves a lot of times the back of the neck and the muscles around the upper back. And then there's the migraine type presentation, which usually has an aura that precedes it, which is a sensation that this episode is coming on, and it usually involves extreme pain, light sensitivity, sometimes nausea and vomiting in extreme circumstances. Those are the two main categories. Now, a pediatric patient is a patient that's less than 18 years of age, and unfortunately there's over 1 million missed days of school each year because of headaches. So it's really important to understand in this age group what the different factors are that could be causing these different types of headache presentations, and more importantly, what to do so that you can prevent it from becoming a chronic condition throughout life. We won't talk about all the different factors that can impact headaches in a pediatric population, but we're going to focus in on a category of structural injury that could be contributing to some of these signs and symptoms. In the pediatric population, especially young athletes or folks that are experiencing head and neck traumas, whether it's a whiplash, sports injuries from impacts, slips and falls where they hit their head, or even just the roughhousing that kids normally engage in that can be structurally traumatic, one of the things that we need to consider is the structural integrity of the junction between the head and the neck, which is called the upper cervical spine. So a lot of times folks will ask, how can a pediatric patient, either a child or an adolescent, have a structural problem that would require a chiropractic intervention? And I like to always reference the scoliosis screening that any primary school student would have, either at a doctor's office physical or a pre-participation physical for a sports team. And that's where we look for a gross or large-scale structural abnormality with the spine. So one of these smaller or more subtle structural abnormalities that can occur and contribute to the onset of pediatric headaches is what we call an atlas displacement, or a structural shift in the balance of the head and the neck. Now, the upper portion of the spine, which is at the base of the skull, is the most movable part of the entire spinal system, and as such it's most susceptible to injury. So whether it's sports participation, whiplash in a car accident, fall down the stairs, or roughhousing type of injury, you can have an abnormal disruption of the joint surfaces in the craniocervical junction. We call that an atlas displacement, also known as an upper cervical subluxation. And when that happens, it kicks in a variety of different mechanisms within the body that could over time lead to the onset of headaches. There are a lot of sensitive nerve tissues that can be irritated or inflamed as a result of an abnormal structural alignment of the head and the neck. And in this portion of the spine specifically, the brainstem region, the superior cervical ganglion, the trigeminal cervical ganglion, and a bunch of other sensitive nerve tissues that supply pain sensations to the head and the neck, as well as muscular contraction of the head and the neck, can be affected when the atlas has displaced. Usually when there's a structural shift in this area of the spine, it's no big deal and often goes overlooked, but over time those compensations that kick into place with the postural muscle contraction will lead to increased tension around the head and the neck. Now, as the body adapts to that tension over time, it takes less and less stress to produce an episode or a hypersensitivity of those tissues. For pediatric patients who are experiencing frequent or recurrent migraines or tension type headaches, it's important to go through a detailed history and understand what the structural strains and traumas that they've experienced that may have potentially caused an atlas displacement. And one of the unique features of neurostructural care is that we can provide a precise and specific adjustment to correct that abnormality of alignment and mechanics without twisting or popping or cracking the neck. So if you're in the Colorado Springs region and think that there might be a structural component to a pediatric headache presentation, whether that's for yourself or a child or a family member, I always offer a complimentary consultation, which is a simple conversation between you and I, which allows me to understand your needs and your history, and to explain more about neurostructural versus conventional chiropractic methods, and how we take folks through a process of correction that is geared towards improving upon those structural instabilities in the upper cervical spine or the craniocervical junction.